Now, there are warnings of a potential crisis in NHS dental services in the south if more resources aren't put into recruiting and retaining staff.
Well, it comes as the Colosseum Dental Group announced it's to close its 3 practices in Paulsgrove, Portsea and Southsea, leaving thousands of people in Portsmouth without an NHS dentist.
Well, the company says it's due to ongoing challenges in recruitment, and other dentists say they're facing similar pressures. Rachel Hepworth has more.
Have your wisdom teeth coming through?
Phil Gowers was a dentist for many years. He now represents others in his profession, some struggling to fulfil government contracts at a time when most dental vacancies can't be filled.
This puts an amazing amount of stress on the team, so much so that mental health issue is a real problem. Those that have the highest NHS contract have the lowest morale. And I've got 4 cases at the moment. I'm trying to save some dental team members from a very sad situation.
The pressures have been too much for Colosseum, who last week announced the closure of 3 surgeries in Portsmouth, leaving NHS patients with no option but to go private or travel longer distances. Those within the profession say it's a national problem, which the government has not been addressing.
We've been telling them that this crisis is about to develop. They haven't believed us. We need receptive ears in NHS England and the Department of Health to actually produce solutions, because we as a profession would like to provide proper care for our patients.
And the fear is that without an accessible alternative, patients, and in particular children, just won't go to the dentist, leading to bigger problems in the long run.
It's a lot better and a lot cheaper to have preventable disease than trying to cure and catch up on something that's caused a major problem. If you look at the most common reason for 9 to 13-year-olds to go to hospital is for tooth extractions, and that costs the government £35 billion a year.
NHS England say they're offering support for people to find alternative care, but some dentists fear the crisis will only deepen if the issues are brushed under the carpet.
Rachel with us now. Rachel, what will these closures actually mean?
Well, of course, my report was focusing there on the impact on dentists themselves, but they will say, of course, it's all about the patients, and in this case, some 9,000 of them. The worry they have that if a dentist isn't easily accessible, then people simply won't go for regular checkups. And that could store up more problems in the future. We've done stories in the past, of course, on Meridian of extreme measures, people taking measures into their own hands if they can't find a dentist, even extracting teeth themselves, which clearly we don't want to see. But because these changes haven't happened yet, we don't quite know what the impact will be. So that's why we want to hear from our viewers as well about how it affects them for good or for bad, so we can get a better picture of dental provision here in the south.
Rachel, thank you very much.